It's an unprecedented time with an unprecedented need.
It's been tough, right? You know, what I say is that, we all went into healthcare because we like taking care of people.
Healthcare faced with a new and contagious virus.
This isn't going to be a sprint for any of us. This is going to be a marathon.
Tonight, WGL has partnered with the Pennsylvania Medical Society to get answers to your coronavirus questions. Good evening, I'm Jerry Gish, and we've been bringing you Doctors on Call for 17 years here at WGL. And during this pandemic, we wanted it to continue. But this year, as with so many things, it'll be a little different. You submitted your questions on the WGL Facebook page, and we will now ask those questions to doctors over a Zoom call. So joining us tonight, Dr. Joseph Irwin of WellSpan Family Medicine, Dr. Michael Pavlica of Family Eye Group, Dr. James Rochester of WorkNet Occupational Medicine, and Dr. James Medina of Lancaster Emergency Associates. Doctors, thank you so much for being here tonight. We appreciate you taking your time to answer some important questions from our viewers.
You're welcome.
My pleasure.
All right, let's get into the questions, and we have a lot of them tonight. And Dr. Rochester, we'll start with you. This question is from Amelia, and actually it's two questions, but they're similar. How long should one isolate prior to returning to the community if infected? And how long after one ceases to experience symptoms are they no longer contagious?
That's an excellent question. Currently, the CDC guidelines list 14 days quarantine, self-quarantine from onset of symptoms, and at least 3 days post-symptom free before you would consider coming out of quarantine. The issue is that that data relies on the old SARS epidemic that happened a few years ago in China. Recent data suggests that people shed virus for quite a bit longer. Data out of China, data out of Europe suggest an average of about 24 days of shedding virus, some up to as much as 49 days. But that shedding virus doesn't necessarily mean you're infected. You're shedding parts of the virus, but not necessarily infective. There was a small study published about 2 weeks ago out of Europe that looked at people shedding virus and actually did viral culture on them, looking to see did they have infectious virus. And after about 9 to 10 days, they couldn't culture any more active virus, suggesting that that period of infectivity might be around that number of days. But again, it's a very small study. Hard to say with a lot of significance, how accurate that is, but it gives us an idea.
So it sounds like that 2-week period we've often heard about is about right.
It could be, and again, it's based on the old SARS, which was pretty well studied. We're still learning a lot about this virus, even how it works, how it infects, what damage it does. The old virus was more of a respiratory virus. This seems to be more of what we call a vasculitis, seems to affect the blood vessels, leading to problems. So a bit different virus, but roughly sounds about right, yes.
All right, next question is for Dr. Irwin, and we've had a lot of questions about testing, getting tested for coronavirus. And here is a question right now from Alexander. How soon after you contact can you test positive? If you get tested today, is it possible to be infected just before the exam?
Excellent questions. So what Alexander is referring to is what we call an incubation period. So if a patient is exposed to the virus and receives a dose of virus that can cause infection, they should start testing positive anywhere from 2 to 14 days after the exposure. And that's that 14-day thing that we've been talking about. So if you've been exposed and you don't present with symptoms by 14 days, you can assume you did not receive an adequate dose to become infected.
But also the possibility then exists, let's say, you're 5 days in or something like that, you could test negative, and that means later, though, you could still test positive.
Yeah, so the current test is a nasopharyngeal swab, which is not the most comfortable procedure. Basically, you have to insert the cotton swab all the way to the back of the nasopharynx. So that location, if you look at your throat in a mirror and you look at the back wall well behind your tonsils and then hook a straight up, that's where the swab has to go. So that's pretty deep. So we're seeing about a 30% false negative rate, meaning that you have the disease or you have the virus and yet the test says you do not. That's false negative. 1 out of 3. And so it's partly due to the test itself, but also the collection, we believe.
Right. Okay. All right, the next question is for Dr. Medina. Danielle emailed us, and we certainly have heard a lot from the very beginning of this, comparing the coronavirus to the seasonal flu. So her question is, explain how the coronavirus is different from the flu and why this virus is so dangerous.
So first, how are they similar? They're both the influenza and COVID-19 are caused by viruses. The initial symptoms are very similar: fever, cough, body ache, shortness of breath. But how they differ is first in what Dr. Irwin was talking about, the incubation period. The incubation period for influenza is usually 1 to 4 days. That's from when you're exposed to you start showing symptoms. For COVID-19, it can be 1 to up to 14 days. So they think that's one of the reasons that it's spreading faster, in that people are spreading it before they realize that they are infected. On average, they say someone with influenza spreads it to about 1.3 people. With COVID-19, that's going up to about 2 to 2.5 people. Then you also just look at the disease itself. Just COVID-19 is a more serious disease. Average hospitalization rate for the influenza is about 2%. For COVID-19, it's about 19%. And then when you're looking at the fatality rate, seasonal flu kills about 1 in 1,000 people. For COVID-19, it's about 10 times that. So like 10 in 1,000 people, if not more than that. So COVID-19 is 10 times more lethal than influenza.
The stats are stark, no doubt. All right, thank you. All right, Dr. Pavlica, this next question is for you. If this was an airborne virus, why are airplanes and submarines still in service, since both recycle cabin air? And I think what we're getting at here, I don't know how many of us will get on submarines, but certainly an airplane or maybe other public transportation. And this is an important question in that way.
Yes, so planes and submarines actually, according to the CDC, use HEPA filters, which are high efficiency particulate filters. And they are quite efficient and perhaps more efficient than an N95 mask at filtering out for viral particles. And the recirculation rate in these, in a plane and a submarine is much faster than it would be, say, in an office building. So in a sense, you're potentially breathing purer air than you might be in a regular circulation system. That being said, we've all seen the video pictures of people crammed in like sardines on planes. And even though everybody's wearing masks, you might actually be exposed to someone next to you shedding COVID virus. So the CDC recommends you put off any non-essential travel, and that's probably a good idea. And if you are going to travel, make sure you bring lots of sanitizer. You realize there might be droplets on all the surfaces around you. And, when you can get off the plane, get off.
So in a situation like a plane, it's that dense packing of people that is going to get you more so than the air circulation, I guess.
Well, I think that the air circulation still could, but it's not quite, we all years ago felt, well, you get a flu when you get off the plane, but it may be as much from the fomites touching the things around you. You want to avoid touching your eyes, your mouth, your nose, and also make sure you're wearing a mask and everybody around you is wearing a mask.
Sure. All right, thank you. Well, we have many more questions to come for our doctors. That's coming up in just a moment. As we head to the break, though, here are some symptoms of the coronavirus to make sure you know about. We'll be right back.